Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey veterinary habbers, today's episode is a revisit of a Facebook Live with Anae and Emily Ashdown. And if you're using laser therapy in your practice, this one you're really going to want to listen to. Emily introduces a structured clinical reasoning framework called CWIDER, designed to help guide the safe, effective, and evidence-based use of photobiomodulation or laser therapy in veterinary practice. And what I love about this conversation is how it challenges the way many of us think about laser. Instead of being protocol-driven and device-led, Emily explains why it needs to be parameter-driven and patient-specific, and how that shift can completely change your outcomes. She walks us through each part of the CWIDER framework: class, wavelength, irradiance, dose and delivery, emission, and research, and how all of these factors work together to influence safety, biological response, and clinical results. We also dive into the realities of research in the space and some of the challenges we face in the veterinary field when it comes to building strong evidence around laser therapy. This is one of those episodes that will really deepen your understanding and help you use laser more intentionally and effectively in your practice. Now, if you like to keep learning, we've just updated the free webinar area with some fantastic webinars you can all access now. Talking Tendons, Advances in the Management of Tendon Injuries with Diane Messam, Using Hydrotherapy to Manage Developmental Conditions in the Dog with Tanya Grantham, and Luxating Catheters in the Young Horse with Gillian Tabor. You can head over to onlinepethealth.com/free to access those webinars. A quick word from our sponsors. Support, prevent, and rehabilitate. That's the Paw Prosper way. We've built a portfolio of industry-leading brands like Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, and Blue Nine to give your patients the gold standard in care. And we have some big news. Paw Prosper is officially the new home of the Canine Rehabilitation Institute and Onlinepethealth. We're bringing the best products and the best online education together under one roof to help you and your patients thrive. As a special hello to the Onlinepethealth community, we're offering a one-time gift with your next order when you sign up today. So head over to pawprosper.com/OPH and join the movement in pet rehabilitation. Right, let's dive into all things laser therapy.
Hi guys, and welcome. Hi Emily, thank you so much for joining me.
Thank you for having me.
Awesome. Guys, so today we are talking about laser therapy and getting a little bit more intentional with it. Emily is going to introduce us to the CWIDER framework, which I'm quite excited about. Did I say that right? Is that how you say it?
Yeah, CWIDER, whatever is more comfortable.
Okay, fantastic. So we are talking laser therapy. We're talking about having a structured clinical reasoning framework that we can work with so that we can be safe, effective, and evidence-based in our laser therapy. So let's jump right in. Emily, will you introduce yourself and tell us a little bit about your journey into laser therapy and how you became the laser trainer?
Yeah, absolutely. It's been a long journey, but it's been an interesting one. So my background is RVN, so registered veterinary nurse, animal physiotherapist, hydrotherapist, and I've worked in all sorts of different clinics over the past 15 years, from kind of small animal, mixed practice, large charity hospitals, then moving into kind of management, leading large nursing team. And that's where my passion for physiotherapy started to develop, and that's when I went on into that avenue. And the clinic at the time were looking looking at lasers. So they'd heard about this whole laser thing, and they're like, oh, is this something we could bring into clinic? So I was tasked at the time with looking at all the different types of lasers that were out there. And anyone that's looked into them know that it's a minefield. And it's like, okay, well, what is the difference? Is there any difference? So at the time, the clinic, we went with Companion Animal Health. We liked what they offered. We liked the support. So we implemented that and we set up the clinics. And it became very much my baby at the time. And I loved it so much that I ended up buying my own laser and running mobile clinics in my local area. And I developed a relationship with Companion Animal Health at the time. And I went over to then start helping them kind of just go in and do demos. They were a very small team in the UK. So I started doing demos with them, attending conferences. And that was the starting point. And I've been involved with Companion Animal Health for about 10 years now, where I've gone through clinical support, product support, particularly with stance analyzers, regenerative therapies, and long story short, brings me to now where I work as international training and education manager. So I'm so fortunate that I travel all over the globe and get to talk about my favorite subject, lasers. So very long story, made short, but it's been a great career. I can't argue that.
Wow, that is amazing. Do you do that education and that international travel and training specifically for Companion, or did you start that on your own somewhere along the way?
Yeah, so I primarily Companion. I've done a few things over the last couple of years, kind of more independently. I was involved independently setting up the very first off-call regulated laser therapy qualifications, which again was a big game changer because there's nothing like it out there. So I've done a bit of both, but even through my work with Companion, it's purely education and just looking at the research and going, where is the research right now? What can we do? What can't we do? And where does it need to head in the future?
Yeah, I love that. Companion's fantastic. They really have wonderful, wonderful products. So I think that's a great company to have kind of started off with. Yeah.
Yes.
When you were working clinically, what problems or patterns were you repeatedly seeing in the way that laser therapy was being used that then led you to develop the CWIDER framework?
Do you know what? I don't know. I mean, I guess there's two avenues, practical and theoretical here, because, speaking to so many people across the globe about laser therapy, and the one thing was really, really clear is that people generally only had so much knowledge around the devices. They didn't know the potential of so much more that could be done with them. A lot of people see laser and they see arthritis and wounds and they stop. So there was kind of that side of the clinical application side of things. And then there was actually understanding the device and the parameters. And again, I think, and we'll probably talk about this, people understand the class of laser and they understand that wavelengths are involved. But again, that's where knowledge seems to stop, and no one dives deeper into that. So the theory side was frustrating for me because there's so much confusion in the market, so many different devices out there, so much technical speak that is very complicated and confusing. So I think people just haven't embraced the full science behind it. And then the practical element again is, many therapists that I would speak to, they're like, oh yeah, I use laser as part of my tool bag. They either use it a little bit or a lot, but results are really variable. You can speak to so many people and some are like, yeah, I get amazing results, and some results are hit and miss. And I was like, why is it that there's so much variation? And that was part of my journey to start digging. And actually the University of Harvard did this before I got a chance to dig, but it was helpful because they did the same. They had the same question. why does some people get good results? Why do some people not? And why does the research show that as well? Why are some papers really positive and some papers not so? And so they were the start of where CWIDER kind of ultimately came from.
Ooh, okay. I like that. So, okay, let's talk about CWIDER. What is it? Can you describe that for us? Go into as much detail as you want so we can really understand what this is that we're talking about.
Okay, so CWIDER is an acronym, and it covers all of the key parameters that you need to be effective with your laser. So this started, myself and a colleague, we had a brand new team in the UK, and we were doing all their training, and we were looking at the training protocols that they had, and all the information. It's okay, there are so many elements to understand with a laser. How do we make this simple? So that is where CWIDER came from, because what we tend to find is people pigeonhole and they just look at class and wavelength, and they don't look at the bigger picture. They might look at the financial side of things as well. You know, is that laser within my financial budget? And again, it's that lack of awareness of all the other parameters. So we wanted to make it as simple as possible to help people make educated, or have more of an educated understanding of the device they have, or the device that they're looking to buy. So CWIDER is class, wavelength, irradiance, dose, emission, and research. And these to me are all the key elements that when someone says they're looking into a laser, or they're trying to work out whether laser would be effective for a certain condition, these are all the elements that I say you need to understand to then be able to understand the device you have. So class, as we know, probably the biggest elephant in the room. It's the biggest one we all debate. Class ultimately, and again, it's a common myth that people think the class of laser is what dictates how successful your treatment is, how deep it can penetrate, when actually it's not at all. Class is how powerful is that device, and what is the health and safety implications because of that power. And you'll see in a moment that they do all link in together. So we couldn't just look at class and nothing else. So like I say, we commonly talk about 3B, class 3B and class 4 lasers. They're the most common. And it's simply class 3B is up to half a watt of power. Anything over is a class 4 laser. And again, what's interesting around class is that then people have started ticking the class 4 box. Well, as long as my device is class 4, that's all that matters. But a class 4 device could be 1 watt, 5 watt, 10 watt, 15 watt, 20 watt, in human med 40 watt in continuous wave here. Obviously, if we start adding in pulse lasers, you start seeing 75 watts and above, which will, again, I'll explain that in a moment. So as you can see, just because it's class 4 doesn't mean that every laser offers the same amount of power. So that was the one side. So that's class. Wavelength. This is our next step. So what wavelengths does your device use? And this is how we take those photons to the target tissue. And wavelength is dictated by what are your goals of the treatment. You know, if you're treating something really superficial, you don't necessarily need as longer wavelength as we would if we're trying to reach the spinal cord or the hip joint. So it's all about, do we have a long enough wavelength to reach the depth that we're trying to target? And we have, if we look at the electromagnetic spectrum, we have what's called the therapeutic window, which is a space between 600 and 1100 nanometers. And if you use a wavelength in that spectrum, you will have a therapeutic effect on tissue. However, some of those wavelengths will be more readily absorbed by what we call incidental absorbers. So your hemoglobin, your oxyhemoglobin, your fat, your water. So whilst between 600 and 1100 nanometers, that's a big range that we can be therapeutically effective. Actually, some of those wavelengths are more effective at targeting tissues than others. And some of them are absorbed more readily by melanin than others. So that's why we'll often see devices will have a couple of wavelengths. They won't just have one wavelength, because depending on what you're trying to target, where you're trying to get to, will depend on which wavelength. So we've got our class, which is kind of that initial, how much power does the device have? Your wavelength is how you're going to get that light there. Now the next one, irradiance, is my favorite one because nobody talks about it. And this came from the paper from the University of Harvard, where they really pulled this one out because it wasn't talked about. And irradiance is how bright is that light as it passes through a given area. So, you know, we know the closer to light source something is, the brighter it is, the higher the level of irradiance. The further away it is, the lower the level of irradiance. And people will often ask me, okay, how deep does your laser go? Like, give me some centimeters, 1, 2, 5, what is it? And that's not a question that's easy to answer, because actually light doesn't just stop. It's that irradiance gets less and less as we travel further away. So actually that brightness, that irradiance becomes less and the impact becomes less. And I always liken this to summer versus winter. You know, summer, we're a lot closer to the light source. The irradiance level is higher. You know, the impact on us is much higher. So we're all happy, tanned, pain-free, feeling great. When it comes to winter, it's the same light source, but we're much further away from it. And that irradiance level is much lower. So we're all pale, miserable and painful. That's why we see this increase in pain in arthritic patients in the winter. You know, it gets cold, it's miserable, you know, we see all these changes. So it's exactly the same here with our irradiance. Now, putting that in terms of our laser devices, this is where they all interlink, because actually when we look at class and the amount of power we have at the surface, the higher the power we have at surface level, the higher the irradiance you'll have at depth. So if you're targeting the same, you know, if we're targeting that hip joint, if I've got 5 watts at the surface, the irradiance at that hip joint is going to be different if I then had 10 watts or 15 watts at the surface and that irradiance. So this is where they all start to interlink with each other. So then we move into delivery, dose and delivery. So dosing is probably one of the biggest bugbears, in that we do not dose our patients properly. We either use protocols that are built into machines and don't question the dose, or don't actually know what the dose rate that's being used is, or again, as we've seen in research recently, we've seen there's been the hip OA paper, the elbow OA paper, the DM paper. All of them have shown that a higher dose rate of 10 to 20 joules per centimetre square is more effective than using the traditional 8 to 10 joules per centimetre square when we're looking at deep tissue structures and particularly larger patients. So dose is my biggest bugbear, in that I'm always saying, you know, first of all, do you know what the dose rate in your protocols is? And if you don't, you need to know. And second, would you, if you had a headache, take a quarter of a paracetamol or a pain medication and expect the same results as taking a full paracetamol? And again, this is where I believe, again, we're seeing these hit and miss results. Why are some people getting results and some people not? Well, actually look at the dose. Did they fully dose the tissue? And did they treat the entire area? Because unless you've got X-ray vision, you can't see all of the area that has been impacted by that disease. You know, we can hazard a guess, but let's take arthritis. You know, you've got your joint, you've got your tendons, your ligaments, you've got the muscles surrounding, you know, above and below that joint are all impacted. So are we fully dosing that tissue to the full extent? Then we've got delivery. So are you in contact or off contact? We know being in contact with the tissue, we get less reflection, less scatter, and we get we did a study kind of with a companion where we placed a spinal probe in the base of a canine cadaver and used contact versus off contact to see how much light would reach it. We got up to 67% more light reach that spinal probe with contact than with off contact. So again, the importance of how are you using your device, in contact, off contact, all matters. Then we get to emission. We're coming to the end, I promise. We come to emission. And this is, are we continuous wave? Are we pulsing? Are we super pulsing? And again, I feel like this has become a bit of a controversial one, a bit of a marketing thing here. But ultimately, pulsing was developed from a health and safety perspective because they wanted, if we turn laser on and continuously emit light, we get a thermal buildup if we're using high power. Super pulsing and pulsing was developed not from a therapeutic point of view, but from a health and safety point of view, so that thermal output was reduced so that devices could become smaller, because small devices cannot handle high heat output. They'll burn out too fast. So this meant that we could take bigger devices, make them smaller by using pulsing. Now, currently to this day, and again, Harvard confirmed this, there is no evidence to support pulsing being more clinically effective than continuous wave. It's not to say we can't achieve results, we absolutely can, but there's nothing to say one is better than the other. The challenge becomes that when we have continuous wave, we turn it on, we're able to deliver that high dose that we've talked about very quickly. And obviously we have ways to mitigate the thermal output by scanning. When we pulse, we have a problem, is that if we're doing that, we then have to do one of two things. We either increase our time that we're treating, because ultimately if you're turning the light on and off, on and off, that's just going to take you a bit longer to deliver the same dose. Or we reduce the dose. And interestingly, most lasers will reduce the dose, not the time. So again, when we come to the dosing point of view, we're underdosing.
Oh, I kind of thought that when they pulsed or super pulsed, they were pushing up the power so that they could shorten the time period and have the same dosage.
Yep, so it pushes up the power, but that's the peak power of the device. The actual power that we're interested in is the average power, which is actually a lot less. So it might peak up to 75 watts, for example, but actually that's only a peak. It's the average power that's normally at, say, 3 watts is what's actually being achieved. So it's not 75 watts. So it sounds great, having 75 watt device, that sounds amazing, but there's no physical possibility that you can have higher power without having that thermal output and being able to deliver the higher dose in the same amount of time. So this is where it's really important that you understand your device. And yes, 75 watts is the max output, but actually that's not the part that's important. It's the average power that you want to know. And that will then, again, help you decide, okay, that's fine, but we either treat a bit longer or we reduce that dose. And then finally down to research, and this big important one, human and animal research, clinical. I really advocate, we need to push the animal specific papers out there. We've been building so much over the last few years. Now we have studies over a companion on everything from DM to diarrhea to dentistry to, like we said, arthritis. So it's pushing it, but we need to push our companies more, that we're not just happy with a device to be just put on the market because laser's a good money maker for them. We need these companies to invest more in the research to show that their parameters are effective. Because actually, when we take CWIDER, if we took 5 devices right now, each one different, none of their parameters are the same. So our CWIDER is different for each one. And actually, as we've just explained, that dose rate is going to be different, that irradiance is going to be different, that wavelength is going to be different. So you can't just say, okay, this paper says it was successful, I can recreate that. You need to then go, okay, well, what was the parameters that was in that paper? Can I recreate that to be as effective as possible?
I love that.
So that was a lot, I know, but hopefully it explains it.
I think it gives a really good, like you say, framework for us to work from, because I mean, I know myself, electrotherapy is not my favorite thing in the world. And then when it comes to all of this, I know that every aspect is important. So it's overwhelming. I don't understand. So I leave it alone and I walk away and I go find something else that I can understand and work with, and that kind of suits me better, to the degree that I sold my laser a couple of years ago because I was like, no, thank you.
Yes, and this is it, isn't it?
Yeah.
It's so complicated, and we've made it so complicated over the year. You know, they're not simple devices. I mean, no electrotherapy is, but it's how much do we actually deep dive into the parameters in these devices? And we should be. You know, we're asking clients to pay for a service. Do we actually fully know what we're doing with the devices?
I think it's so important from not only a patient outcome perspective, but also our professional accountability, that we understand what and why we're doing it. I love that you say, you know, like every protocol from every laser is going to be different. They don't match up with each other, and why. And if we're just selecting, we're just using our laser device and going, oh, OA of the knee, let's go. That's not good enough. And I really want to challenge everyone. If you are doing that, it's not good enough. Get educated, understand why, play around with the parameters and figure out what is going to be the best fit. So Jen Carroll, hi, it's so good to have you. She says, excellent summary of the features of laser therapy. Thank you. I agree.
Thank you. I appreciate that, because I know it's such a complicated subject. And trust me, it's taken me 10 years to figure it out. And I've been in the middle of the whole industry for 10 years. So that was why we came up with CWIDER, because we were like, okay, how do we take a complex subject and make it more digestible?
Okay, let's talk about research. I love that that is your final part of CWIDER, because it often isn't the thing that we think about, right? And again, when I think about laser therapy, this aspect, research, going into the literature and trying to make sense of it, is one of the worst parts of it, right? Like all the parameters of the laser, you can understand them because you can learn them, and that's all good, right? You can make sense of them. But when you come to research, it just is such a mess. It's a mess because no one article matches another article. They're using completely different parameters in every sense, and sometimes they're not reporting on it. So you don't even know what they did. And then it's just like, well, how am I supposed to recreate this in clinic, use it or not use it, avoid this outcome or pursue this outcome? Just how do you even use that? So talk to us a little bit more about the research and where you would like to see us going in the future.
Yeah, no, absolutely. And you know what? Research was one of those things I probably avoided for many years, in terms of didn't understand it. I didn't understand, how do I actually read a paper? How do I tear it apart? How do I know if it's clinically relevant? And it was a goal I gave myself a few years ago, that I was like, right, I need to embrace it and I need to be able to understand. So it's something that I think is a bit of a process if you're not as comfortable reading research papers. But to just give you an idea of how much research has gone into laser therapy, if you go onto PubMed and you type in laser therapy, there are over 103,000 papers on laser alone. And if you type in photobiomodulation, which is it's the cellular level of what's happening, there's over 8,500 papers. That is a lot of research. I think in comparison, I think I was looking at radio frequency, there was like 2,000 papers, just to give an idea of comparison. So it's not that we haven't tried, and it's not that we haven't been doing it. It's just like you said, for a long time we were like, well, why is it working here and it's not working over here? And like you mentioned, parameters are just not reported properly. And again, that's why Harvard got so frustrated, and they were like, right, let's figure this out. Why? And I know from a companion's perspective of the research that they've been doing, they ensure that all those parameters are reported. It's now kind of standard. So I think we need to encourage the industry that no longer is it acceptable just to tell us the dose rate that they used. We need to know, the irradiance, the wavelength. We need to know all of those parameters to be able to implement it. But I think, we have come a long way, and particularly on the veterinary side, because, when I first got into this, it was all human data that we were trying to move over. And whilst human data is useful, and obviously in some ways we use it a lot for other things, when it comes to laser, again, we've now got hair to battle against. We've got fur that we don't have in humans that absorbs a lot of our light. Our tissue makeup, while technically is the same, if we're treating a hip on a human and a hip on a dog, it's very different in terms of depth, penetration, everything. So again, I want the industry to embrace more veterinary research. I'm kind of fed up of seeing companies launch lasers into the industry and not put the work to help us as clinicians to understand why their set of parameters works. Because in my mind right now, there's actually only one set of devices that has the research to say, if you use these parameters, these are the results you're going to get for this specific condition. And it can't be a generalized, laser works for all joint conditions, laser works for all spinal conditions or all skin conditions, because again, do we need different parameters? One of the areas that's being explored at the moment, which I love, is the brain and cognitive function. And in the human side, they've been looking at everything from ADHD, autism, depression, obviously dementia. And we're only just starting to dabble with this on the veterinary side. And so far, there's only good indication for cognitive dysfunction. But one of the questions right now is pulsing or continuous wave actually, are they, they give us the same results? Is one better than the other? So there's a bit of a debate going on about that. So I would love to see more companies embrace veterinary specific research so that we can really go, okay, does this set of parameters actually work for this condition? And again, drive it. There's so many applications for laser therapy. I always teach people, because people will say to me, oh, does it work for this condition or does it work for this condition? Go back to the root of laser. It helps with pain, inflammation, and tissue repair. So if you have a condition, whether that's urinary, whether that's renal, whether that's the brain, whether that's a joint that has pain, inflammation, or damaged tissue, the chances are it's going to work. What we don't know is what parameters we need to be effective. So 2 directions: more people researching and more a wider range of conditions that we're looking at.
Okay, I really like that. Do we have, I know in the human research, Walt created the guidelines for research so that if you're studying something, you're going to do it in a specific way so that we get that repeatability and comparability. Do you think we need that within the veterinary field? Do we need to have like guidelines that guide how research is done so that we're not just all doing random things? Everyone who's doing research comes up with a random idea, tries it out, and then we're not actually working towards a common goal.
Yeah, no, absolutely, because research can be very daunting when you first start reading it if you're not as comfortable and confident. I actually use the RCVS Knowledge Hub a lot to help me understand and break down papers. I feel like you do get to a point where you're like, okay, is any research paper actually perfect? Because I feel like I'm just tearing apart every paper. But I guess it's the general gist of, okay, whether the research absolutely says it can or cannot work, we've at least started something. We've at least gone, okay, what does it tell us? And what clinically as a practitioner can I go, okay, well, we don't have any data yet on cognitive dysfunction. It's kind of, we've got some case studies. So let me try it on a patient because there's some good indication. And actually, I tried it on my own dog and it's been amazing for him. So I think it's not about saying the research is solid and you can only do something if the research all backs everything. I think it helps us to make clinical decisions of, okay, is there a reason that I might try this? And if so, okay, let's give it a go. But I think frameworks, whether it's WALT, whether it's like I say, I liked the RCVS hub because there was no specific link to laser, because the one thing I'm always concerned about is bias. I think there's always a natural bias within any area of any industry, depending on who's writing it. So I wanted something completely independent, but having that framework for me to then refer to really, really helped.
Oh, cool. Awesome. Jen has left us a lovely comment. So all of the early research was so inconsistent back in the 70s, which is one reason why laser therapy for animals was not supported. Too many variables, so not comparing apples with apples. Same thing happened with people research initially, but far better now. So more research for animals that are not rats. I agree.
Yeah,
Great
agree.
work also done on blue light for infection management. Yes, I think that is something we should, the different lights and when you're going to use which one. And there's so much.
Completely agree.
This is actually such an amazing modality. Amazing.
Like I say, it's a minefield and there's so much great work being done. And you know what's been really interesting, being on this side of the fence, I never realized how hard it actually is to get a paper published. And I don't think that's given enough credit. I think we automatically are very much like, oh, if it doesn't have research, it doesn't work. And very much if if a company's involved with research, there's a bias. And I can't say there isn't. Do you know what? I cannot speak for the greater good and say that there's papers out there on any subject that doesn't have any bias. But the one thing I've really realized is research is mega expensive. And if you don't have these companies buying in, it honestly can't happen. That was a big eye-opener for me. And then actually getting patients in. So a lot of the research we've done has been averaging, 20 to 40 dogs. But we have an amazing network of clinicians, and independently, Dr. Alves in Portugal is an incredible man for research for laser therapy, and he has access to military police working dogs, so he has a great hub of dogs. But day-to-day research, getting dogs into studies is so hard. So I think that's one of the biggest things people will say, oh, there's not enough dogs in that study. It's so hard to actually get them in there.
Yes, I agree with you. I think like when you are really critical about literature that's published, it becomes tricky because there's always something that isn't ideal, that doesn't measure up, right? And having a company being involved in a paper, agreed. Of course, now you've probably entered bias in there, but also the paper wouldn't exist without them. And is there still valuable information in there? So I always kind of think, if I know these things, if I'm aware of this flaw in the methodology or this aspect of it, or this company's involved, they've declared it, then I kind of want to just say, well, great, I'm taking that into consideration. I hear that. And what does it mean at the end of the day? Is this still valuable? I think that, let's not talk about the greater good. I think that most of the time people are not going to mess with data. If they're publishing research, they want the data out there, but maybe that's not true. Maybe not. Okay.
Yeah, I can't speak on the greater side of things. I didn't want to generalize and say it doesn't happen, because I don't honestly know. All I've seen is what I'm involved with, and it's done to the highest standard. But like when we're pulling data apart, it's always one of the first things people ask is a company involved? So it's always interesting that that's the first thing in our minds.
Yeah, I don't think we should be disqualifying data That's what I'm saying. Don't disqualify a paper because it isn't perfect or they haven't stuck to 100% the best methodology. That isn't always possible. Sometimes it's better to have the information than to have it perfect, right?
Exactly. Yes.
Yeah. So I think that's important. We did a recent research review where in terms of methodology, the more standardized you can have the treatment that you're performing, right? You're always doing it this way.
Yeah.
Always. It's always the same. The better the research is. But from a clinical perspective, you never do that. You're always adapting it to the patient in front of you in terms of whatever the parameters are, right? That should be true for every modality you pick up. It's not the same on every patient that comes through your hands. So I always have this toss up, right? Like, if we're going to have research that shows that this protocol exactly like this is going to be effective, then how do we apply that in clinical practice?
Yes.
And when I have papers come out that have patient-specific treatments that have been performed, I rejoice. I think that's amazing. That's one of the best things ever. But from a research quality perspective, that's a massive drawback. It's like, how do I balance those two things, right? It needs to be clinically real, clinically applicable. Real patients have comorbidities, multiple things happening.
Agree.
You have to make adaptations to the treatment program versus the highest quality of research. Like, we've got to just balance the scale.
Completely agree.
Yeah. Okay, so I've gone off on a tangent. Sorry.
Sorry. That's okay. I have a habit of doing that.
Okay, so let's get back into laser. For clinicians who already own their own laser, and they may be very used to using the protocols that are on that laser, they just select the one and then go for it. What's the first practical step that they can take to start applying your CWIDER framework into their daily treatments?
Yeah, I think the first thing is just actually take CWIDER and literally write it down. So class, wavelength, irradiance, etc. And then look at your device. And if you don't know, or it doesn't state in the manual that you've got, contact the company that you bought it from and just get these parameters from them, because then you take, okay, it's a class 3B or it's a class 4 box. Okay, we know that, but how much power does it actually then emit? Okay, we know that. Wavelengths, we know which wavelengths we have. Irradiance, again, relates to the power. But I'd say the most critical one for me is the dose. What is the dose rate that's actually used in the device that you're using? And then that gives you that starting point where you can go, okay, I know if I'm selecting an arthritic protocol on my device that I know it's using 8 to 10 joules per centimetre square. So then clinically, you can go, okay, well, I've got some patients. I've got a couple of patients that are doing fine, and that is the case, because the other difficulty here is as light penetrates through, we're saturating all these tissues before we get here. So you could be getting effect from the device you have, because actually hitting that fascial chain or supporting some of those muscles that have been really tight and tense, we're getting results there. But why don't we try and see what happens if we increase that dose? Does my patient get better? Like, we get even better results? Or maybe you've got some patients that you've tried it on and it didn't really work. You didn't get the effect that you were looking for. Okay, well, let's try doubling the dose. What happens when I treat for a little bit longer and I increase that dose? Same if I'm using pulsing continuous wave. Do I understand what I'm using? And if I've been using pulsing and it's not been to the same effect, let's try increasing that dose and just see what happens to your patients. I always say, no laser doesn't work. It's not that the devices don't work. It's just, are we getting an okay response? Are we getting a good response? Or are we getting a great response? Because, even if I look at the timeline of companion lasers, 10 years ago, we had 6-watt CTL9 lasers that were low power, low dose. We didn't not get results back then. It's not that we didn't, but because we now understand more, we've increased that dose and we've increased that understanding, and we're seeing even better response. So that's what I'd say from a practical point of view. Go away, go and look at the CWIDER, just write down, okay, what are the parameters of your device? Is there an area that maybe you could change, or maybe actually you're happy with all the parameters? But then you have the confidence that when you're using that device and you're using that preset protocol, you know exactly what you're administering.
Oh yeah, I love that. Can you, I just want to understand something a little bit better. So you spoke about the irradiance, right? And that's the kind of depth or the amount of light that's reaching a particular depth, right? So if I'm thinking about that or speaking about that, am I going to think in terms of my irradiance is 50% at 1 centimeter depth? And so if my dosage at the surface is X, then my dosage at 1 centimeter is going to be half of that. Is that how I'm thinking about it? And then my treatment point is probably 3 centimeters down in this large breed dog. And so I want to increase my dosage to X so that I will reach that. Is that how you're going to think through that one?
So there's two components that can change the irradiance. So first of all is power, obviously, that we talked about. The second one is actually your spot size as well. So the smaller the spot size, the more concentrated that beam's going to be. So if you know the diameter of your treatment head, and it may be that you have different size treatment heads, you're going to then have an understanding. And I don't think there's a framework out there yet that gives you a specific calculation that says you need this level of irradiance at this depth. So it's not quite as straightforward with it at this point. But I think it's just being aware of, again, if you've got 5 watts at the surface, but you're using quite a big head, do you have the ability to make that head smaller? To increase that irradiance at depth? Or if you're using 5 watts but you have the ability to use 8 watts, what does increasing power? Now again, we have to obviously kind of put out there that if you're using continuous, you need to be mindful of your thermal output. So increasing your spot size or your power at surface, what does that then do from a thermal perspective? But normally your devices will have a range for you to use. So for example, if I use like a small treatment head, I know that essentially 3 to 5 watts is where I'm comfortable using that. Anything over, I need a larger head. So it's about looking at the device that you have. How big is the head, the probe, the spot size, and then what can you do with your power to increase or decrease? My first go-to, if you're looking at your parameters and you're like, okay, I've got a patient that's not doing so well, let's look at changing. The first thing I'd change is the dose before I then started playing with the irradiance side of things.
Okay, thank you so much. So my last question is, where can people learn more about CWIDER or continue their education around intentional evidence-based laser use?
Yeah, no, and there's kind of 2 avenues for me. The companion website has a whole library and archive of free webinars that I really recommend, particularly if you're learning the parameters. And then I mentioned earlier the Ofcom regulated laser therapy qualifications that are developed last year and is run by Precision Animal Laser Academy. They're great there, and the reason why we developed it was because of this difficulty of understanding the parameters. It's hard to summarize it all in a webinar or in half a day. So we created the qualifications so that there could be a real deep dive that's research based and not biased, to help people go, okay, I want to take my laser knowledge one step further and gain a recognized qualification whilst doing so. Especially CPD these days, we all need that extra bit, so it's nice to get a qualification at the same time.
Okay, I love that. Thank you so much. Guys, I've posted the links to those certification programs in the comments. Hopefully they're working. If they're not working, I'm going to come back and link them again because it doesn't look like they're connected. I'm going to come back and link them again. That's fine. Thank you so much. Guys, if you are an Online Pet Health member, we do have actually a lot of webinars on this topic because it is quite a big one. So go ahead and search in your webinar library as well. We have great webinars that will help you pull apart the topic of laser. And I will inspire you to kind of do better and figure out the protocols that you need to be using, or at the very least, how you need to be adapting your protocols, your lasers protocols. I think that's kind of where I started when I started playing around with it, is looking at the preset protocols and then saying, well, okay, how could I adjust this? What makes sense to me? And kind of going from there. So thank you so much for your time today, Emily. It's been great.
Thank you so much for having me. It's been a really great chat, and hopefully everybody feels a little bit more confident looking at a laser now.
I hope so. Guys, have a great day.
Thanks, everybody.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free. So go and check them out at pawprosper.com. And also don't forget to bookmark the next Vet Rehab Summit on Saturday, the 14th of November, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.